Hi, my name is Eleanor Griffiths, and I'm going to be talking about the Mendelsohn maneuver and the chin tuck neck flexion of treatment strategies for dysphagia. So first, I'm going to start with the Mendelsohn maneuver. What I'm going to do first is have my patient swallow normally, and just to feel how their Adam's apple rises and falls during a normal swallow. And then what we would do, we would take our middle three fingers, so our index, our middle, and our ring finger, and I would ask them to place it on their Adam's apple and squeeze their throat muscles. And when they squeeze, just to hold it as tight and as long as possible, or until I direct them to either stop or whatever. And the length and time for each repetition and number of repetitions is dependent on the client. Next, I would do for the chin and tuck. This is going to involve sitting or standing with your head in neutral position and everything's neutral position, your body, your spine, everything in neutral position. And what you're going to do is you're going to lean your chin in towards your chest. And doing so, this just causes the airway to narrow, preventing food or liquid from going down the wrong pipe. And next, we'll talk about two other strategies.
I'm Sarah Beth, and I'm going to explain what the effortful swallow and head rotation strategies look like for dysphagia patients. So first, the effortful swallow. This is a strategy that involves the clinician asking the patient to swallow as hard as they can. Sometimes the clinician will ask the patient to put their head slightly back or forward, depending on the individual case. The patient is asked to focus their swallow in a controlled, deliberated way in order to put emphasis on tightening or squeezing of the throat and tongue muscles during the swallow in order to increase the force of contraction. So it would just look something like if you ask the individual to put their head forward, they're just going to swallow as hard as they can, like that, or back like that. So it's pretty simple. And you can do that over and over in order to strengthen those tongue and throat muscles. Next is the head rotation. So the head rotation is a strategy that involves turning the head to one side or the other, and you usually turn the head to the stronger side during the swallow. So for instance, if a patient had a stroke and their left side was weaker, then they turn it to the right side. And the purpose of this is to redirect the bolus, the food or the liquid that they're swallowing, in order to have that go down the stronger side. The exercise is usually repeated several times with different consistencies of food or liquids. So all that's going to look like is just asking the patient to turn their head to one side, depending on them, and then they swallow. Pretty simple.